you.
Everyone, and welcome to this Town Hall educational presentation on COVID-19 vaccinations. Today's event is brought to you by a partnership between the City of Carson, Providence Health and Services, and Cal State University Dominguez Hills. My name is Dr. Sophia Momand, and I'll be your moderator for today's program. As it happens, I'm the family doctor for the students at CSU Dominguez Hills in the Student Health Center. And there's not a day that goes by that some kind of question related to COVID-19 viruses and the vaccines comes to me. This pandemic has affected all of us in some kind of way. So at this time, we'd like to hear a brief word from our Honorable Mayor of Carson, Mayor Leila Davis Holmes, followed by the President of Cal State University Dominguez Hills, Dr. Thomas Parham. First, the Mayor. Mayor Davis Holmes, would you like to say a brief word?
Well, yes, thank you very much. And thank you to my alma mater, Cal State University Dominguez Hills, for partnering with the City of Carson and my president, Dr. Parham. It's just so awesome to see you. I've worked with you before, Dr. Moment, and I'm just excited that you're here. You're just a ball of fire. But we wanted to do this, our second informational town hall virtual meeting, because information is powerful. And we want to make sure that our listening audience and our residents get the correct information so they can make the correct decisions on whether to vaccinate or not. And that's why we're doing a series of these workshops, virtual meetings, just to get the information out there. I christened Dignity Sports Park when we vaccinated over 20,000 not all residents, but people. And it's just important to get the information out there, because I was skeptical at first also, until I talked to my doctor at UCLA, and he gave me my options. So I just want to say thank you for all the staff for coordinating this meeting, and thank you to Cal State Dominguez Hills, to Providence, and also the City of Carson. It's a nice partnership. We're going to be doing more partnerships here in the City of Carson. So thank you from a grateful mayor for the participation.
Excellent. Thank you, Mayor. And now we'd like to hear a brief word from the President of CSU Dominguez Hills, Dr. Thomas Parham. Dr. Parham?
He's muted.
You're muted? There you
that
go.
That might help if my elbows would quit hitting the mute button. Dr. Momand, I want to say thank you for the time and space to be able to greet. And I want to greet our mayor and our city councilman Hicks. These are two strategic partners, along with our other council people, I think, who embraced this campus along with our city manager in the City of Carson. So we want to thank the City of Carson really for the invitation to partner with them. And if you want to know, community, what the essence of a strategic partnership looks like, this is what it looks like when we are really doing the business on behalf of the people. It is important to not simply be in the community, but be of the community. And this is what being of the community looks like. Also want to give a special thanks to Providence Hospital, and I think in that institution for their partnership, I think, and in working with this Dominguez Hills campus, they've provided us through their kindness and generosity, COVID kits. And they provided over 1,000 bags of COVID-related safety items that we were able to distribute both to our students as well as to other folk on campus in housing and basic needs programs. And so they helped us to really look at that. Also want to be able to express my support and the importance for the partnership I think that we are doing. There are a lot of cities and educational institutions, I think, who struggle with that. And I think with this new mayor and city council and this president, we have committed, in fact, that we are going to build things together and build better together to help transform both this city and this campus. So I look forward to working with my colleagues in the City of Carson, Mayor Davis Holmes and Councilman Hicks and Hilton and Deere as well, as we move forward with that. I also want to just share a couple of brief updates about our COVID. And I know you've got yourself, Dr. Mamon, and Nurse Natalie Ash with us today. But this campus is committed to wanting to do what we can to both do our testing and be a vaccination site. And if we can get the authorization from both the state and even the federal government to be able to do that, we are poised and ready to move forward under the leadership of Vice President Deborah Wallace and our EOC Director Nora Garcia. And so we are in the process of putting all of those particular spaces together to make sure that we are prepared to deploy our own resources. We're also in the process of putting together our own safety plan to repopulate the campus. And as we gradually look into rolling up and accessing campus facilities, we will do so safely, making sure that we have the health and safety of our entire campus community in the forefront of our thinking. I also want to close by reminding folk, I think, and picking up on the theme that Mayor Davis-Holmes remarked on, which is a notion of power. Power, my friends, is not about military might. It's not about who has the biggest police or military force. It is not about who has the most money. Power is the ability to define reality and to make other people respond to that definition as if it were their own. Hear me well, residents. Because we lose our power when we allow other people to define and frame the discourse for us in believing somehow that there is something wrong with being able to take charge of our own health and health care and take advantage of the resources that are available that keep us less vulnerable and help us to avoid some of the risk that is out there as a function of this COVID pandemic that we are navigating. And so I'm reminded always, as the great Marcus Garvey told us, the chance never satisfies the hope of suffering people. It's only through hard work, persistence, and self-reliance by which the oppressed ever realize the light of their own freedom. And so whether you are affluent or oppressed, whether you are a citizen or a student or traversing through the city of Carson, everybody is part of a community. Dr. King reminds us, my friends, that we are all caught in an inescapable network of mutuality and tied to a single garment of destiny. And that is certainly true in this COVID pandemic. So what we are giving you an opportunity to look at is specific information that can be used to help you think about how to best guard against being infected by this dreaded disease. So pay attention, trust these healthcare workers, and know that, like the mayor and other folks, I have received both of my shots and I am vaccinated, even as I still wear masks, as I am navigating my way through public or in other kind of common spaces, and will still engage in physical distancing until we begin to move not only from the purple tier to red, red to orange, orange to yellow, and then are not at risk at all. So pay attention to the information. That is where your power is. And this Dominguez Hills campus, your Cal State University, Dominguez Hills, is delighted to partner with the city of Carson in trying to bring this information to you. Thank you.
Dr. Parham, thank you for those wonderful words. Just excellent thoughts.
Yes.
Wonderful. Next, we'd like to hear a quick word from the city manager, Sharon Landers. Ms. Landers?
Hey, everybody. I want to start by saying, President Parham, thank you so much for letting everybody know that you've been vaccinated. And Mayor Davis-Holmes has also not only indicated that, but she was present when we opened up the Dignity Health facility, and she was the first person vaccinated. I'm also fully vaccinated. And it's really important, I think, for the public to see that leaders in their communities, both political, educational, and our spiritual leaders are all encouraging everybody to do this. There's a lot of information out right now circulating about vaccines, and there's a lot of worry in our community about historic things that have occurred that make them nervous about whether this is a vaccine that they can trust. And that's why it's been really important for the city council led by Mayor Luba Davis-Holmes and Council Member Cedric Hicks, in addition to our other two council members, to get information out to the community directly from our health providers. And this partnership with the university is something that we're treasuring. We haven't done it enough, but we will be doing it more now. This has provided an opportunity for us to jump onto something where we share mission and values, but you'll see that more and more. This is something where 2 + 2 1 + 1 = 4. 1 + 1 doesn't equal 2. If we add our resources together, we will be able to do far more for the community, but also for the region. All of those things are important to us. So sit back and enjoy, listen, make sure that you really absorb and follow up with us if you need to. We'll be doing more of these. And also we will have some pop-up clinics at our community center throughout April. So keep an eye on our website so that you can get that information. Thank you, Doctor.
Thank you, Ms. Landers, and CSU stands by ready to jump in and help whenever we're called upon. So now, how about a quick update on, speaking of CSU, how about a quick update on the impact of COVID-19 virus on the CSU Dominguez Hills students from our own charge nurse, Natalie Ash. Mrs. Ash works in the Student Health Center at CSU Dominguez Hills. Nurse Ash?
Thank you so much, Dr. Molman. Thank you, Dr. Parham. Thank you to Mayor Holmes and the council folks here, to Dr. Lopes, and to everyone who helped to make this possible. We really appreciate being here. It's an honor to be here. So I'm going to be talking about kind of the impact of COVID-19 on our campus and on our students, especially. This very unique time in history has presented many, many challenges to students here at DH and in Carson. We have to remember that we all are very stressed and weary from this pandemic, but the students have another layer of challenge that's been placed upon them because they are students and they're trying to navigate, you know, COVID-19 and the pandemic and all of the fallout from it, as well as taking care of their schoolwork and, you know, just trying to stay on top of their studies and things like that. And that's contributed to a great amount of stress for them during this time. Since during this time, most of the classes have been shifted to like a more virtual mode of learning. A lot of students have had problems just finding kind of like an adequate space and environment for studying because it might not be, you know, the best environment for them to do their studies at home. I think the campus is kind of like a real sanctuary and quiet space for a lot of our students. And they haven't been able to be here just because of restrictions and things like that. And that's created a big problem for them to where they've had to navigate, okay, where do I study? You know, where do I do my homework? Where do I get computer access if folks don't have, you know, good computer access at home? Where do I print my documents? You know, all of those different things that, you know, we may take for granted. And then a lot of students have expressed that they've either like lost their jobs due to the pandemic, or they've, you know, experienced reduced hours because of closures and things like that. And that's obviously created financial stress for them. And with all of these stressors going on, we've seen a big uptick in increased blood pressure for a lot of our students here. I think probably most of the students that have come through the Student Health Center have had increased blood pressure that's not normal for them. I've talked to a lot of students, and many have been facing like housing instability, or some people, their families have even like faced foreclosure and things like that during that time. So obviously that's very stressful. Eating habits have been, you know, going downhill because people are, you know, either on the run or they don't have enough money to buy healthy foods or, you know, things like that. So they might just be grabbing, you know, snack food or fast food and things like that. Exercise habits are down because, you know, gyms are closed, some recreational places are closed. So, you know, their routines have been uprooted that way. And people, you know, people might not know how to, you know, implement an at-home routine for exercise. Stress and anxiety and depression is up for sure, just due to the isolation of quarantine and things like that. People have lost family members to COVID, and just because this is a stressful time for all of us. So we've definitely seen an uptick in that. And those are just some of the challenges that they've shared with us here. And there are many other unseen and unheard challenges that we don't even know about that, that folks our students are dealing with. In spite of all this, the students are continuing forward and they're persevering in the midst of all this. And that's so inspiring to me and to us. So where the campus is now, we've been officially open during the pandemic, even though most classes have been virtual. We do hope that in the fall, we can look to, open, it up to more on-campus learning, but that's still a work in progress. We don't have anything set in stone at this time. As Dr. Parham alluded to earlier, on campus, we have an emergency operations committee, and they sort of steer the safety, recovery, and repopulation efforts for the campus, and they do an excellent job with that. And they meet frequently to discuss all of the changes. And there are changes every day, as we all know, to happen during this pandemic. And then we do have testing once a week here on campus, and that's for the essential faculty, staff, and students that are here on campus. And that's been an excellent resource. They do a wonderful job. And there's also screening for everyone who comes onto campus with the iToros app. It just goes over, it's like a self-assessment, to make sure that you're not having any symptoms or having any exposure before you come onto campus. And then you're screened before, you go about your business on the campus. And we would love to be a place of distribution for the vaccine, and we would love to be able to contribute to the community in that way. So we're hoping to get more news on that later on. And yeah, that's it. So thank you so much for having us and for allowing us to share on this platform.
Thank you for sharing that information with us, Nurse Ash. And with that, and without further delay, and what we've all been waiting for, we're going to now listen to the presentation on COVID-19 vaccines with your questions answered afterwards by Dr. Anna Sophia Lopes, who is a board-certified family physician at Vaccination Medical Group, an affiliate of Providence Health and Services. Dr. Lopes has spent much of her career advocating for underserved medical communities. Over a career spanning nearly 2 decades, she has practiced family medicine in primary care and most recently in urgent care. A native of New England, her educational journey began at Boston University, where she did her Bachelor of Arts in Mathematics. After undergraduate studies, her next stop was Tufts University School of Medicine to prepare her for the road ahead. As an advocate for organizational excellence, Dr. Lopes currently serves as the chairperson of the Patient Education Advisory Committee and the inaugural chair of the Equity, Diversity, and Inclusion Committee at Vaccination Medical Group in Southern California. Today, you'll find Dr. Lopes continuing to provide mentorship to medical students and volunteers as a community service advocate and educator. Welcome, Dr. Lopes.
Thank you for having me. I'm excited to be here. I also wanted to send my regards to the City of Carson, CSU Dominguez Hill, Providence Health Services, and Vaccination Medical Group for collaborating on this dynamic event. Now, we just heard a fantastic and hopefully uplifting words of encouragement from Mayor Davis and President Parham. So I just want to set the tone. We're going to keep the same energy up, the same enthusiasm, and I want this to be a message of hope. So with that, let's go ahead and dive in. Just first slide. Well, I think we're on the Q&A, so we just need to back up a little bit and
pull up her presentation.
yes. And while we're waiting for that, I'll also share a little bit about the COVID-19 vaccinations. We have given over 100 million vaccinations in this country. So that is success. And I just want to commend CSU Dominguez Hills for all their efforts. And I hope that you guys are successful in becoming a vaccination site because many people are interested in the vaccine. Okay, so here we go. First slide. So what we know about COVID-19, what we know is that COVID-19 does not discriminate. So this lecture is for everyone, regardless of political background, race. We know that the infection with SARS-CoV-2, which is the virus that causes COVID-19, can result in a range of illnesses, from mild symptoms to severe illness and death. We don't know how it will affect each person. Some people we know become severely ill, older adults, 65 and over, people with certain medical conditions, hypertension and diabetes. Next slide. We know how to prevent COVID-19. Carson City has done a phenomenal job wearing a mask that covers your mouth and nose, avoiding close contact with others, staying at least 6 feet, which is approximately 2 arms length from another person. Avoid touching your eyes, nose, and mouth with unwashed hands. Clean and disinfect frequently touch surfaces daily. And we're recommending that you use an alcohol-based sanitizer with at least 60% alcohol when soap and water is not available. Also use that hand sanitizer on your hands. And just like we learned in kindergarten, wash your hands with soap and water. Next slide. Now, this is the piece we're going to talk about, is the COVID-19 vaccination and what role it's playing in prevention. Next slide. So to date, we have, I see this is the old slide deck. We actually have 2 mRNA vaccines that have received emergency use authorization. And then we have one dose DNA vaccine, which I like to call a viral vector vaccine. I'll get into that. What emergency use authorization is, it's a process that facilitates the availability and use of medicines and vaccines during public health emergencies, such as this current COVID-19 pandemic. The vaccinations for COVID-19 are being held to the same safety standards as all vaccines. That's very important. Next slide. And I'm going to go through these slides very briefly, but what I want people to take away from this is that 45,000 individuals were enrolled in the Pfizer-BioNTech study and 30,000 were enrolled in Moderna. Next slide. In Johnson & Johnson Janssen trial, we know that 45,000 individuals were also enrolled in that slide. And when we break down the demographic of the participants, it breaks down like the US population. So we see anywhere from 10 to 19% Black Americans are enrolled in the trials, Asian Americans, Native Americans, white Americans. So the vaccine trials did a fantastic job of reflecting the US population. Next slide. Now, I've seen a lot of people talk about how vaccines work. What it is a set of instructions. This is not gene therapy. Okay, I've heard that some people say that this is gene therapy. This is not gene therapy. It is not incorporated into your DNA. The mRNA vaccine sends the instructions to our cells to make a harmless piece of spike protein for the COVID-19 virus. So after that protein piece is made, the cell breaks down the instruction. So the mRNA doesn't stay in your body. Your body actually gets rid of it through cells called macrophages, which is our type of white blood cells. Now, those cells display this piece of spike protein on their surface, and then an immune response is triggered inside our bodies. This is how we produce the antibodies to protect us from getting infected from COVID-19. This is very important. I've also seen people say that Once you get vaccinated, the cells, the antibodies just keep producing. This is also false information, okay? The mRNA vaccines do not use the live virus that caused COVID-19. Therefore, they cannot give you COVID-19, and they do not interact with our DNA. They are new in vaccines, the mRNA technology, but it's not, the technology itself is not new. It's been studied in other infections. Next slide. What we know about the mRNA vaccines, by now, most people know that you need 2 shots to get the best protection. The first shot just primes the immune system and helps it recognize the virus. The second shot strengthens the immune response. And then I want to talk a little bit about the side effects. Next slide. So if you've gone to one of these sites and you have decided to get the vaccine, some common side effects that we see from the immunological response are fever, headache, joint ache, muscle aches. I just want to talk a little bit about some home remedies because some people are not connected to care. As someone mentioned, people have lost their jobs. You might not have a primary care doctor right now, but you can take acetaminophen, which is the ingredient in Tylenol, ibuprofen, which is commonly found in Advil, Motrin, or just use a cool compress. People also have experienced soreness, redness at the injection site. A cool compress can also help with that. A lot of my friends and my mom, she experienced fatigue after her injection. Rest and staying hydrated with fluids is very important. The average person needs about 2 liters of fluids a day. And most of these side effects are treatable at home. I also want to discuss nausea. Someone told me that they had a metallic taste in their mouth. They can trigger nausea, and just taking small sips of fluids will help that abate. If the symptoms last more than 2 to 3 days, then definitely you want to follow up. But what we know about the immunity that it's creating and the immunological response, these reactions usually last 48 to 72 hours. Next slide. Now, I've heard a lot of people talk about this. Are they safe? You know, I'm also a mother, so this was important to me. And once I looked at the data, we had 8 weeks of safety data were gathered after participants received their second dose in the trial. It is very unusual for you to develop a side effect after 8 weeks after a vaccination. That's why there was high confidence in releasing these vaccines for emergency use authorization. There were no significant safety concerns in the clinical trial. A small amount of people developed severe allergic reactions. Those are anaphylaxis. But when we looked at the data again, it was not higher than what we expected to see in the general population. So this was very favorable. Also, after your vaccine, we are recommending that individuals stay and be in a monitored setting for 15 to 30 minutes. And that way, if you have an anaphylactic reaction, you can get care. And then there's more information on the CDC website regarding COVID-19 vaccines and rare severe allergic reactions. Next slide. Well, how do we fast track these COVID-19 vaccines and still keep it safe? We had government cooperation, just like we do today in this town hall. We also had university cooperation. We had the pharmaceutical companies, the clinicians, the scientists, all on the same page to produce these vaccines because we are all trying to end this pandemic. I know no one who's not affected by this pandemic at this point. So we used vaccine clinical trial networks to conduct the COVID-19 vaccine trials. We enrolled over 100,000 individuals into these trials. That's why with certainty, we feel that they are safe. Manufacturing of the vaccine also was underway while the clinical trials were happening. This usually doesn't happen. mRNA vaccines are faster to produce in large amounts than traditional vaccines. And all of this is happening while the FDA, CDC are prioritizing review and authorization of the COVID-19 vaccination. Next slide. And I won't go over this in great detail, but these vaccines were held to the same safety standards as all the vaccines, as the influenza vaccine, the tetanus pertussis vaccine, the shingles vaccine. The FDA did review all the safety data from the clinical trials, and the ACIP, which is another body, reviews all the safety data before recommending its use. And we are still monitoring the vaccine safety and side effects. And there's good news. We've now extended, we've made a statement from the CDC that we have that says that pregnant women can be vaccinated. So this is why it's important to enroll in and monitor your vaccine safety in one of those vSafe or one of the vaccine safety program monitoring. Next slide, I have it on the next slide. And these are the existing systems and data sources that we use to monitor the safety of vaccines. The one that I was involved in was called vSafe. It's an app that you can use right on your phone, and it actively asks you questions and it takes demographic information. And with that, we were able to make other recommendations as well. Next slide. This is very important. Getting a COVID-19 vaccine will help create an immune response in your body against the virus. It will also help you from getting severely ill, even if you do get COVID-19. And it may protect your family, your coworkers, and your patients. In the Johnson & Johnson trial, we're seeing many of the new data is very promising, and it shows that once you get the vaccine, you are protected and you are unlikely to be an asymptomatic carrier. This is wonderful. Next slide. It's also a safer way to build protection. So getting the virus that causes COVID-19, yes, it will provide some natural protection known as immunity. But you also risk having a severe illness and death from COVID-19, which far outweigh any benefits of natural immunity. The COVID-19 vaccination helps you because it helps your body create an antibody response without getting sick. And then both natural immunity and immunity produced by a vaccine are important in COVID-19 disease. And we're still trying to learn more about that. Next slide. This is just one other way we have to help stop the pandemic. So I just want to pause and I want to speak to all the people on the front line. I want to speak to the sheriffs who are watching this. I want to speak to the police officers. I want to speak to my medical personnel. I want to speak to the teachers because schools are reopening. I want to speak to my grocery clerks, people who work in food industries. You are considered frontline. You are essential. You keep us going. And, you know, the pandemic has shown us who is important, and you are important. The vaccine is highly effective, and it's one other tool we have to help prevent and end this pandemic. So I really hope that you would consider taking the vaccine. Next step. Next slide. Here are the facts. I've seen a lot of people come on and talk about the facts. I hope after the end of this pandemic, Cal State University, Dominguez Hills, and other institutions will be equipped to produce more scientists, more doctors of excellence, because everyone has had a say in some of the facts in the COVID-19. But here they are. None of the COVID-19 vaccines in use or under development, and by the way, there's over 150 vaccines under development worldwide. They're not using the live virus that caused COVID-19. People can experience normal side effects, such as fever after vaccination. These side effects are signs that your body is building immunity. The mRNA vaccines that are currently authorized require 2 doses for best protection. Receiving 1 dose only gets you halfway there. You do need that second booster, and you can take the second booster up to 6 weeks after. And then it does take a few weeks for the body to build immunity after vaccination. We believe it's about 2 weeks. A person could be infected with the virus. So this is why it's important for the sheriffs, the police officers, all those frontline people that I listed to continue wearing their mask while they're not fully vaccinated. You could be infected with the virus that caused COVID-19 just before or just after vaccination, and you could get sick. This is because the vaccine has not had enough time to provide that immune response that we talked about. Next slide. Now, vaccines will not cause you to test positive on a COVID-19 viral test. So if you test positive, that is a true infection, okay? There is a possibility you may test positive on some antibody tests, which show previous infections. This would indicate that the vaccine triggered an immune response in your body and that you may have some level of protection against the virus. Next slide. People who've had COVID-19, they should still get vaccinated with a COVID-19 vaccine. Due to the severe health risks associated with COVID-19 and the fact that a person can become infected with the virus more than once, the vaccine should be offered regardless of whether you already had COVID-19 infection. Now, at our institution, what we're doing for the sake of equity, if you have antibodies and if you've had COVID-19 within the past 3 months, we're asking you to delay your vaccination by 3 months. But you can also speak with your healthcare team to make a decision that's best for you. At this time, we don't know how long someone is protected from getting sick after recovering, getting sick again. Next slide. So listen, here's my message. I took the vaccine. I felt it was safe. You heard Mayor Davis talk about knowledge is power. I looked at the science. I looked at the research trials. This vaccine has undergone so much scrutiny. I do feel that it is safe. I would recommend that you get vaccinated when it's available to you. And just to speak, which one should you get? The first one that's available. If your plane is crashing right now, where society is crashing because we're in a pandemic, and you have a chance to grab a parachute, you want to grab the first parachute that you can and make that safe landing. All 3 vaccines prevented serious hospitalizations and deaths. Also participate in VSafe and help the CDC monitor for any health effects after vaccination. And then share your experiences with your coworkers, friends, family, your medical team. Know the basics about the COVID-19 vaccine and help answer questions from your family and friends. I've heard a lot of misinformation. And then help be an ambassador, visibly show you received a vaccine, and you can wear a sticker or button or just tell your story. That's what we need to hear. It's just one-on-one people telling their stories about the vaccine and what happened. Next slide. Okay, and you can learn more about COVID-19 vaccinations on the CDC website. And I just want to close with this. I'm a family physician first. I treat patients daily, regularly in the urgent care. And I just want to encourage you guys to stay healthy. Get your fruits and vegetables in, follow a healthy diet, exercise. There is a role that vitamins play, vitamin C, vitamin D, zinc. And if you have access to a doctor or your medical team, please do talk to them and make an informed decision and decide if this vaccine is right for you. I do hope you get it. And thank you for this opportunity.
Thank you so much, Dr. Lopes, for that highly informative presentation. I feel safer already now that I've got my vaccination completed. And now we've got some questions up from our audience for you.
Great.
Here's the first one. What would you say to people who are living alone and not having a sense of what may happen to them in their homes after they take the vaccine?
There is So first of all, the most common reactions are the ones that I saw. If you're a person who's not linked to care, you don't have medical insurance for whatever reason, the vaccine is still safe. We haven't seen huge cases of anaphylaxis that caused us to pause. We haven't seen huge cases of Bell's palsy. I know some people were worried about that. What we're seeing is what mirrors in the general population. So the vaccine is not giving people any more adverse outcomes than what we would expect to see in the general population. So you can feel safe. There are also resources available, calling 211. You can go online and get resources. And most of the side effects can be treated with those home remedies that I mentioned in the slides. Acetaminophen, ibuprofen, those can be found at any pharmacy, at the dollar store. So it should be very manageable at home.
Excellent. Here's the second one. When a person has received the vaccine in the household and the others have not, what precautions should be taken, if any, until the entire household has received the vaccine?
Fantastic question. I love this question. We are still in a pandemic, and that's why it's still important to wear your masks. Now, there is new guidance on the CDC website. People who are vaccinated can now gather with other people who are vaccinated, and they don't have to wear a mask. Why is that? The data that I mentioned from Johnson & Johnson showing that there's low risk of becoming an asymptomatic carrier is fantastic. We didn't have that data before. So this is really reassuring, but still practice your mitigation. You still want to social distance when you're in big crowds. Keep gatherings limited. If you can, stay within your household. That's how we beat COVID. We know this.
Excellent. Here's a third one. The Pfizer and Moderna vaccines require 2 shots. Is the Johnson & Johnson vaccine stronger since only 1 shot is required?
Ooh, a nurse asked me this question. A nurse friend asked me, because I'm senior, I think it's better for me to take the Moderna or the Pfizer because they break up the doses. That they're actually different vaccinations, and that's not exactly how it works. My suggestion is to take the first vaccine that's available to you, because you know what? All 3 vaccines were 100% effective in keeping you out of the hospital from COVID-19.
Got it. Okay, here's the next one. What information can you share that will help alleviate the fear and apprehension African Americans and other communities of color have in taking the vaccine, given our history of mistreatment in this area, especially for those who are 65 and older?
I hear you. We did a whole talk on this. This is a whole 30-minute lecture. The Black Physician Councils got together at Facing Medical Group, and we talked about Tuskegee. We talked about forced sterilization, and we talked about the traumatic history of racism in healthcare. Now, the vaccine is not a cure for racism, so we know institutional racism still exists. That's why, as President Parham mentioned, as Mayor Holmes mentioned, knowledge is power. This is one tool you can use to protect yourself. At the heart of the Moderna study is a Black scientist, Dr. Kizzy Corbett, who was, she was pivotal in making this vaccine happen. We also know that several Black physicians and scientists were enrolled in every step of this vaccination process. Why? We didn't want to see another Tuskegee. And we know, as physicians of color, I know myself, the National Medical Association, the Association of Black Women Physicians, we are volunteering in addition to our full-time jobs to get the message out into the community of color, because we know the vaccine works and we want to see vaccine equity addressed properly.
That is so important.
Yes.
All of that information to dispel the fear. And the final question is one that you've already answered, but we're going to say it again because we need to reach out to those people who are fearful of the vaccine. The question is, can you still get COVID after receiving the vaccine? That's a popular question.
So listen, look, let's be real here. Okay. That's what people have always asked. Well, why should I get the vaccine? And this is gene therapy. It's 95% effective. It's 100% effective out of keeping you out of the hospital. Here's the problem we're having. Not enough people have immunity. So what's happening? The virus is still spreading. Now, once it's spread, it gets a chance to replicate. With every replication, an error can happen. That's called a variant. That's why we're seeing variants pop up, because the virus keeps replicating. We knew this. We're scientists. We study virology. We knew this was going to happen, basic microbiology. What we need people to do is to get immunity safely. We don't want to chance people getting sick. So I still think it's important to get the vaccination so that, one, we can keep our incidence low. That's what we did with the Spanish flu. They didn't have the vaccine. People still had to mitigate, right? People stayed home, and people used alcohol to sanitize everything. And then after the pandemic was over, we had the roaring 20s, right? So we're asking people to do the same. Continue to use those mitigation factors. Continue to wear your masks. The virus can't replicate if it can't find a host. If it can't find a person, it dies. So that's where these rules come from. They're not just made up in science. They're not trying to control people. They're based in science.
Great, wonderful. Any final thoughts? That's all the questions we have for now. So any final thoughts on the whole concept of vaccination? And
listen, I just want to speak. I know there's some people who are for vaccine, and I know there's some people that I won't reach. They're just vaccine, it's not for them. So I just want to speak to those people that are in the middle of the continuum. You're thinking about the vaccine. You still want to wait longer. I spoke to a good friend yesterday who's a nurse, and she's still waiting for more data. She doesn't feel that there's enough data on the vaccine. What does it do for pregnancy? What does it do to women? So far, the mRNA or the DNA, the data has been solid, okay? 8 weeks is enough time to study when you are studying 100,000 individuals. And I just wanna highlight that number again, because people who have never done research trials have no idea what that number is like. If we run a research trial with 1,000 individuals, we're screaming hallelujah. So can you imagine just the synergy and the energy that it took to get 100,000 people enrolled in these 3 vaccination trials? And then these people are still being studied, and we have gone into additional studies with children, right? And the data on pregnant women will be released as well. So it's very promising. So if you're in that middle, if you're in that continuum where you're not sure, the data is there. I would strongly recommend you get the vaccination. That helps provide herd immunity, which is protection. It's not just about you. It's protecting your neighbor. It's protecting your grandma. It's protecting your auntie. It's protecting your grocery workers. And a lot of people don't have access, or some people can't get the vaccine for whatever medical reason. So this is what we do as good citizens, as patriots, to protect our community.
Thank you so much for this wonderful presentation. Knowledge is definitely power, and you've presented so much knowledge on this subject. I just hope people can put it into their lives and benefit themselves and protect themselves against the virus. Okay, and with that, can we get some final thoughts with the remaining minutes from our City of Carson Council members? Let's start with Mayor Pro Tem Jim Deere. Mr. Deere, are you there?
I don't believe Jim Deere is with us.
Okay.
It'll just be Councilman Hicks.
Okay, Councilman Hicks, would you like to say some final thoughts?
You're on mute.
I'm off. Am I off on mute? Oh, okay, there I go. Again, this was very informative. I learned some things that I thought I had known, and now that I have been given this information, I'm more equipped to talk to the constituents here in the city to let them know that the shot is safe. It's something that needs to be done. Dr. Lopes, you explained it very well, very succinctly, and information was very good, and you can understand it, and I say in layman's terms. A lot of times people may talk on a different level and people are not able to understand, but to Cal State Dominguez Hills, thank you for being along with this with Providence, to our Mayor Lula Davis Holmes, for spearheading this, and to the staff at City of Carson, that we continue doing these town hall meetings for our residents here in the city of Carson. Based upon the last number, we were at 98,000. And I know at the university, our numbers are growing exponentially, because we have been a destination university over the years. And I just say to all of you guys, thank you for being here, and that this is truly information to live by and to grow off of. And then again, thanks to all who put this together.
Thank you very much, Councilmember Hicks. And with that, we'd like to mention how ever grateful we are for the partnership between the City of Carson and CSU Dominguez Hills. We are specifically thankful to the City of Carson for their invitation and opportunity to partner on this program. We would also like to thank Providence Health and Services for their partnership, and the COVID kits that the President mentioned. So in closing, I'd like to thank all of you again for joining me on this educational program, and we hope you have benefited by it. Stay well, stay safe.
I believe Dr. Moman, President Parham had his hand up just a moment ago.
Oh, I'm sorry, I didn't see that. Yes, President Parham.
Thanks, Dr. Moman, and Kali as well. I simply want to close my remarks in this session again by thanking Mayor Lula Davis Holmes and Councilman Hicks and the City of Carson and Providence Health, and really applaud Dr. Ana Sofia Lopes for an outstanding presentation. But I need the residents to really take what she said to heart. There's a difference between all the information you see and having it penetrate some of the biases that you have, because fundamentally what we as a team of connected individuals are doing this afternoon, ladies and gentlemen, is asking you to trust that this is in your best interest. But I want to tell you, in my opinion, that real trust is not an external circumstance, it is an internal virtue. Let me say that again. Real trust is not an external circumstance, it's an internal virtue. Real trust is not making these scientists and these physicians jump through 5 and 10 and 15 and 25 hoops in order to earn your trust, despite the history that Dr. Lopes has been very clear in talking about. We've all been there. We are concerned about the history with Tuskegee and other experiments that have done, and the guinea pigs that they've used as Black and Latinx folk and women and other people, and that is all real. But what is true about this, if real trust is not an external circumstance, it's an internal virtue, the question you have to interrogate this afternoon in listening to this symposium and presentation is not whether you can trust other people, but citizens, whether you can trust yourself enough to take a risk. And what is true is that this COVID, right, pandemic and this virus is an equal opportunity employer. It does not care if you are a Republican, a Democrat, Black, white, blue, brown, or purple, and nowadays even young or old. People are dying of this in record numbers. Over 500,000 people are doing it. And so viruses, right, as they do that, we have to have protection against that. And much like a flu vaccine or something else, it doesn't keep you from getting the flu again. You'll catch the flu again. It simply minimizes, right, the impact that it's likely to have on your body. And as Dr. Lopes said, it's important for us to remember that any protection that you can get, whatever parachute you can grab in this plane that's going down, you need to grab, whether it's the Pfizer, the Moderna, or the Johnson & Johnson one, whichever one is important. So please pay attention to that. But think about this, trust yourself enough to take a risk with these scientists in this community who's trying to help, right, and empower you to better take care of your own health and healthcare.
Thank you, Dr. Parham. I'll add to that by saying, I was a frontline worker and I watched my colleagues and I stand up there and take the vaccine. We were the first people to take the vaccine. None of us have had any problems. Sore arm, yes. Most of us just got by with a headache. And like Dr. Lopes said, it's just a 24, 48 hour feeling of uncomfortableness, and then you're good. And so with that, I hope people have courage enough to use the science and the power that they've been exposed to, with the knowledge that they've been exposed to, and really protect themselves. So now I'd like to say,
Dr. Moment,
yes.
I just want to close. Again, we're going to be having a vaccination site here in the city of Carson within the next two, it'll be this month. We just had one at Prevailing in Christ. These virtual workshops, forums will be held monthly until we get all of our Carson residents vaccinated, because again, we have to get the information out. We've had such positive feedback from the first one. This is our second. We will be doing a third one, but we will be getting information to the university about our vaccination site that's going to take place within the next 2 weeks. It'll be at the Carson Community Center on 10 o'clock. We have to work out the dates. It'll be after Easter though. So thank you so much. I trusted myself, Dr. Parham, and I took the vaccination.
Yay.
Okay, thank you.
Thank you very much. All right, everybody, be well, stay safe, and take care. Goodbye for now. Thank you for
Thank you.
joining us.
Thank you.
Thank you.